There's very few, 24 international board-certified lactation consultants, and I think we have 5 here in St. Luke's. Choose a hospital that's baby-friendly because hospital is quite important. The minute you enter, the minute you get admitted, we already make sure that your journey, your success is there because we have steps to do that. So you are assured that in St. Luke's, your breastfeeding journey is supported.
Good day everyone, I'm Dr. Jing and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts.
Hi everyone and welcome to another episode of MD in Focus where we bring you expert insights on health topics that matter most. For today's episode, we will be discussing the importance of breastfeeding not only for babies but also for mothers and families. Breastfeeding provides the best source of nutrition for infants, strengthens immunity, fosters bonding, and even offers long-term health benefits for moms. To guide us through this important discussion, we are honored to have with us Dr. Cristina Cornelio.
I'm Dr. Maria Cristina Cornelio. I'm a pediatrician, fellow of the Academy of Breastfeeding Medicine and international board-certified lactation consultant. I am the head of the lactation unit and human milk bank and connected with St. Luke's Global.
Dr. Cristina Cornelio, thank you so much for joining us today. I'm sure we will all learn so much from our guest tonight. So let's start. My first question, Doc, is why is breastfeeding the gold standard in nutrition for infants? And are there benefits for both infants and mothers or just for infants?
First of all, thank you for having me here. It's a privilege for me to talk about something that I'm very passionate about. So why is breastfeeding the gold standard? So it's really uniquely designed by nature to support our infants in every aspect, nutritionally, immunologically, developmentally. And as we all know, or I'm sure, breast milk has a lot of things that formula doesn't have, which is living cells, hormones, enzymes, which really is very important to the nutrition of the infant.
Living cells.
Yeah,
living
cells. Can't be replicated by formula milk. No? So they've been trying to, but they weren't able to do that. And we go to the benefits that you asked earlier. So for the benefits for the infants, breast milk really protects them, not just acute but chronic illnesses. It also prevents allergies. And for the mother, it reduces postpartum bleeding. It also helps for the uterus to contract, so making the uterus smaller,
faster.
So our mothers want that. It also promotes weight loss. So it's not really just nutrition. It's really more. It's like a biological dialogue between the mother and the infant.
So what are the usual challenges that mothers face during for breastfeeding?
So usually I tell my patients that the hardest part is really the first few days, especially in the hospital, up to maybe 2 weeks postpartum, because well, the infant has been there for 9 months, and of course the transition is different. So there's a lot of things going on. And normally the mothers, first-time mothers, the challenges that we usually note is nipple pain, difficulty in latching, also concerns in insufficiency of milk supply. So these challenges are real, but it's manageable with the right support system. So we always make sure that we support mothers, and we tell our staff and also the family that all mothers shouldn't go through this breastfeeding journey alone.
It's really difficult. I remember when I had to breastfeed, and like you said, I felt like it was so little, it was inadequate. And I remember crying while taking a shower because I felt like I wasn't producing enough. And it's really different now that we have these lactation units and all this support for mothers. And I'm glad that we're able to talk about it and share it with our viewers.
Yeah, maybe a decade or 2 ago, during my time when I was a resident, we would really just separate the mothers and the infants. So we have what we call the well baby unit. We took that out. From the very start, we put up just a lactation unit to replace the well baby transition. So we make sure that mothers from delivery all the way to discharge are together. They're together.
So there are different kinds of breastfeeding, right? There would be what we call exclusive breastfeeding and mixed breastfeeding? Would you be able to like differentiate for our viewers?
When we talk about exclusive breastfeeding, it's really no other supplements, no other liquid except for breast milk, all the way 6 months, up to 6 months. Even water, vitamins. Actually, before we would give all kinds of vitamins, but it's only very limited to vitamin D. So no supplementation. So for mixed feeding, it's a combination of formula, supplements, or even just donors is also a supplement. But it's still considered exclusive breast, yes.
How does one decide? Like, how do we decide if we have to transition to mixed feeding, or it's really supposedly exclusive breastfeeding?
Actually, we tell our mothers really to exclusively breastfeed. So it's really dose dependent, no? So you get the full benefit of breast milk if you do the whole 6 months. Of course, we respect the mother whether you are exclusively breastfeeding, mixed feeding, or even milk formula. We will be there. We will support you.
Okay, but the recommendation is the first 6 months.
It's ideally exclusive breastfeeding, and just because we tell our mothers that even just a small drop or a small amount of supplementation can dilute the benefits of breast milk. So sayang siya. Kasi again, it's dose dependent. Like, just to give you an example, if you exclusively breastfeed for 4 months, you get the full benefit for risk reduction in upper respiratory tract infection. So, yes. Yeah, so for that's 4 months. But if you go on and exclusively breastfeed until 6 months, you get the benefit from leukemia, those doses. Yeah, so, and even for the mother, there's also benefit for the mom. So against breast cancer, ovarian cancer, and the data is there and is verifiable.
Any practical tips you can share with our mothers in the audience, or maybe their families? How can they support the breastfeeding journey?
To make sure that you are successful with the 6 months, first of all, you have to prepare and plan and choose a hospital that's baby friendly, because hospital is quite important. The minute you enter, the minute you get admitted, we already make sure that your journey, your success is there, because we have steps to do that. In that sense, we are recognized that we meet standards of the WHO, global standards. Complicated cases like complex issues needing diagnosis, management, and treatment, we have in St. Luke's lactation professionals. No? So there's very few, 24 international board certified lactation consultants, and I think we have 5 here in St. Luke's, yes, all over, and 5 already in St. Luke's. So you are assured that in St. Luke's, your breastfeeding journey is supported.
Okay, so is there any message you want to share our audience regarding breastfeeding or anything about lactation?
Yeah, so for our moms, no, so breastfeeding, although it's natural, it's a learned behavior. So be good to yourself, have that grace, ask for help. We are here to help you. And the important thing is you don't have to be perfect. You just have to be present for your infant, for your baby.
Thank you so much, Dr. Cristina Cornelio, for sharing your time and expertise with us today. Your dedication to supporting mothers in their breastfeeding journey is truly inspiring. So to our viewers, we hope you were able to pick up helpful insights and encouragement from this episode. Remember, breastfeeding is a journey best taken with the right guidance and support. So here at St. Luke's, we are always ready to walk with you through every step of motherhood. So thank you for tuning in to MD in Focus. Until next time, stay informed, stay healthy, and take good care.